Hello. This video is going to demonstrate the arteries of the lower limb. We're going to start with the abdominal aorta, and on this first slide we're only going to go through the largest vessels in the lower limb, some of the major ones, and then in subsequent slides we're going to go into a lot more detail with a lot more of the smaller vessels that are going to be traveling all the way through the lower limb. So, starting with the abdominal aorta, it terminates as the left and right common iliac arteries. So here we're only going to follow the right common iliac, so the left has been cut off here, but all of these branches, or at least similar ones, are happening bilaterally. So the common iliac artery is going to divide into the external iliac and internal iliac artery, which have some important branches to the proximal trunk as well as the lower limb. The iliac artery has two branches going posteriorly that are the superior and inferior gluteal arteries, and like the name implies, they're going to be supplying blood to the gluteal muscles, so gluteus maximus, minimus, and medius, as well as the tensor fascia lata and some other nearby structures. Anteriorly, we have a few branches. The obturator artery is going to be traveling towards the medial compartment of the thigh, and it does not go very far in that compartment, but it does supply some lower limb muscles on the outside of the pelvis. So that's the obturator artery. Going to the external iliac artery, we've got the branch that's traveling up the posterior side of the anterior abdominal wall. This is called the inferior epigastric artery, and it's a major blood supply to the rectus abdominis muscles. As we pass underneath the inguinal ligament, out of the abdomen and into the lower limb proper, the external iliac artery, that vessel changes its name to become the femoral artery. Now the femoral artery has several branches, and as it descends in the anterior compartment of the thigh, it's going to supply big muscles like the quadriceps, the sartorius, and related muscles, and it gives off the deep femoral artery, which is going to supply some of the muscles in that compartment, but also the medial adductor compartment muscles, and it also has several perforating branches that are going to help supply blood to the posterior compartment of the thigh, which is where the hamstring muscles are. Now, in addition to all that, the deep femoral artery has a medial circumflex femoral artery, which, as its name implies, is going to wrap around the medial side of the femur, the femur bone, and go supply the femoral head. It is, in fact, the major blood supply to the head of the femur. There's also a lateral circumflex femoral artery, and it has three branches. So we're going to have an ascending branch, a transverse branch, and a descending branch. These are also supplying blood to muscles of the anterior compartment, as well as some of the gluteal area. Before we reach the end of the femoral artery, it's going to give off a medial branch that's fairly superficial. This is called the descending genicular artery, and genicular implies that it's going towards the knee. So the genu, or bend, of the lower limb is the knee, and this artery is traveling along its medial superior side. Now at this point, the femoral artery is going to pass through a septum separating the anterior and medial compartments of the thigh from each other, and it's going to pass through some of the fibers of the adductor magnus muscle, and the gap it travels through is called the adductor hiatus. Now at this point, it's going to be on the posterior side of the knee. So this illustration is very stripped down. It's only showing the vessels, but it's not showing you the fact that we've moved from an anterior position with the femoral artery to a much more posterior position here with the popliteal artery, which is what it's called when it's in the popliteal fossa, or the area posterior to the knee. Now in this area, it's going to give off several branches, and sometimes the names can be a little overwhelming, but what you want to remember about these genicular arteries wrapping around the knee is that we've got one for each quadrant. So there's a superior medial genicular, a superior lateral, an inferior lateral, and inferior medial genicular artery. These form a genicular anastomosis around the knee, allowing blood to move around and find various routes and connect with branches like the descending genicular artery or descending branch of the lateral circumflex femoral artery. There's also a middle genicular artery which supplies blood to the structures inside the knee joint itself. Now in the posterior leg, the popliteal artery ceases to exist when it splits into the posterior tibial artery and anterior tibial artery. Now the anterior tibial artery passes through the interosseous membrane between the tibia and fibula, and that's how it gets to the anterior compartment of the leg and supplies the muscles that are there. The posterior tibial artery And another branch of it called the fibular artery, they're traveling between the two posterior compartments of the leg. So they're between the superficial and deep posterior compartments of the leg, and they're supplying those muscles. So muscles that are going to be strong plantar flexors and flexors of the digits are going to get their blood from these from these branches to the muscle. And the lateral compartment of the leg is going to get perforating branches from the anterior tibial and fibular artery. Now we've run out of the leg. We're going to cross into the ankle and foot now. Posteriorly, the posterior tibial artery will branch into the lateral and medial plantar arteries after it passes medial and a little bit posterior and inferior to the medial malleolus. And these are going to be supplying blood to the structures on the lateral and medial side of the plantar foot. So the sole of the foot gets its blood from these vessels. The anterior tibial artery crosses the talus, crosses the ankle, and changes its name to become the dorsalis pedis artery, or the artery to the dorsum of the foot. So it's on the other side, and it's going to have several branches, and it's going to form a nice anastomotic loop with some of its branches here, making the arcuate artery on the dorsal side of the foot. It gives off several dorsal branches to the digits, and that's what's represented there. And on the sole of the foot, we have a branch from the dorsalis pedis connecting up with the arch on the plantar side. So this plantar arch is getting blood from the lateral and medial plantar arteries, and also some reinforcement from the deep plantar artery, which is a branch of the dorsalis pedis. Now, this illustration is showing that it's hooking up with the medial plantar artery. Much more commonly, though, it has a bigger connection through this plantar arch with the lateral plantar artery, but I wanted to drive home the idea that this is on the medial side of the foot. So that's why the illustration is shown the way it is. And this is going to give off several plantar metatarsal branches that will then become plantar digital branches. So that's it for the gloss or overview of the arteries of the lower limb. The subsequent slides will go into each of these areas in quite a bit more detail. We'll begin our detailed look at the branches of the lower limb arteries by starting back up inside the abdomen and moving into the pelvis. I recommend that if you want to really nail this down, you actually draw along, and just lines are good enough. They're much easier than these space-filling pictures, but I'm a bit of a perfectionist and so wanted to put myself through hell to get this. So I hope you get to enjoy on that account. So the abdominal aorta splits into the left and right common iliac arteries. It has a small continuance that goes down the anterior aspect of the sacrum. This is the median sacral artery. And right here we've got our split between the external and internal iliac arteries here. Now the external iliac artery will continue into the thigh as the femoral artery, and the internal iliac artery gives off several gluteal and pelvic branches. So let's take a look at those. The internal iliac artery descends into the true pelvis, has an anterior division, which we're showing right here, and amongst the vessels coming off that anterior division, we have the obturator artery, which pierces the obturator membrane, covering the obturator foramen, and it's going to just cover the muscles that are immediately external to that obturator membrane. It really does not go very far into the medial compartment of the thigh. Now, the nearby umbilical artery is really, in us adults, more important in bringing blood to the upper part of the bladder. However, in uterine life, it actually carried deoxygenated blood, or less oxygenated blood, I should say, to the placenta. So because of that, it has a connection to the umbilicus that is fibrous, no longer carries blood. This is going to be the continuance or the obliterated portion of the umbilical artery. And when it's covered by peritoneum, it's often known as the median umbilical fold. But it's really not doing much other than hanging out on the anterior body wall's posterior aspect at this point. Now, continuing down, we have this blind artery here. This is a placeholder for all the branches going to the pelvic viscera. And since these vary in men and women, and they don't really have a whole lot to do with the vessels of the lower limb, we're just using that as a placeholder. We're going to jump back now and see this new area, the posterior division of the internal iliac artery. It's got several important branches, one of which is the superior gluteal artery. it's going to exit the pelvis posteriorly, superior to the piriformis muscle, and perfuse the gluteal muscles like the gluteus medius, minimus, as well as the overlying gluteus maximus, heading off towards the tensor fasciae lata. But inside the pelvis, it gives off a couple other branches. One is called the lateral sacral artery. These are descending and will actually meet their corresponding artery from the other side, and even often will anastomose with branches of the median sacral artery here. They give off multiple branches that go in through the sacral foramina and are going to supply the nerve roots and spinal nerves that are associated with those foramina. We also have the iliolumbar artery, which ascends posterior to the common iliac and is in the vicinity of the psoas major muscle. As it moves up into the false pelvis or even up towards the lumbar vertebra, it gives off a lumbar branch, which also supplies the nervous structures going through the intervertebral foramina there, as well as an iliac branch that's going to go across the upper lip of the iliac crest. Returning to the anterior division, we have the internal pudendal artery. Now, it's not much of a lower limb artery. However, it does have some branches that anastomose with others that we'll see in just a minute. It's going to be the major blood supply to the genitalia and anal areas of the body, which are near the upper part of the lower limb, but not the lower limb itself. More pertinent, though, is its posterior kind of a brother there. As the internal iliac artery ceases to exist, we get the internal pudendal and the inferior gluteal artery, which is going to supply more gluteal muscles, especially some of the lower ones, so gluteus maximus, as well as the lateral rotators like the obturator internus tendon, the gemelli muscles, quadratus femoris, etc. And it's also going to give off a very important artery to the sciatic nerve after it exits inferior to the piriformis muscle and goes into the posterior gluteal region. So you can imagine that this artery, a major blood supply to the sciatic nerve, which is traveling nearby, is going to be a big deal, especially if it gets compressed, which is going to cause nervous pins and needles feeling along the distribution of the sciatic nerve. This is actually one of the reasons that you might have your leg, quote unquote, go to sleep, is because the compromised blood flow, if you're in a weird position or you have pressure on this artery, can make the sciatic nerve start to just seem like it's interpreting pain down the posterior and lateral sides of the lower limb. Alright, so that is pretty much everything we care about for the internal iliac artery. Let's jump back up to the joint between, or the area between, the false pelvis above and the true pelvis below. And the external iliac artery has a few important branches too. The deep circumflex iliac artery is deep in that it's on the inside of the body wall. The anterior body wall is still over here, and it is going to have an iliac branch that may anastomose with the iliac branch of the iliolumbar artery here, as well as an ascending branch that's going to take care of some of the abdominal musculature on the inferior lateral aspect of the abdominal wall. Here we can see the inferior epigastric artery that we saw in the kind of gloss version, the bigger version of these vessels. It's going to be blood supply to the rectus abdominis muscle, which is on the anterior body wall. So it's traveling up that way. And next, we're going to pass deep to the inguinal ligament and become the femoral artery here. So external iliac and femoral artery really are the same vessel, but they have different names depending on whether or not we are inside the body wall or outside the body wall, and actually in the thigh at this point. So the inguinal ligament's right there, and the femoral artery, in addition to some of the larger branches that we'll see momentarily, gives off some very small but somewhat important branches here due to all the surgical procedures that take place in the inferior portion of the abdomen and traveling through the muscles and skin of the wall. We have the superficial epigastric artery, which is going to be roughly paralleling the inferior epigastric, although it's much smaller, taking care of the skin on the outside, overlying the medial part of the anterior abdominal wall. And then we have the superficial circumflex iliac artery, which travels more laterally along the inguinal line between the thigh and the lower part of the abdomen, and just heads up towards the iliac spines, so towards the inferior and superior anterior iliac spines, And then we have a small branch passing inferiorly. This is the external pudendal artery. It takes care of some of the more anterior portion of the external genitalia. It has a deep branch and a superficial branch, and does not fully anastomose with the internal pudendal artery, but these two vessels together take care of the anal and genital regions, as well as some of the anterior genital region here with the external pudendal. Our next step will be to follow the femoral artery into the anterior thigh proper and see its large branches inside that compartment. The femoral artery is the continuation of the external iliac artery in the anterior thigh, and it sends many muscular branches to the quadricep muscle and other nearby muscles in that area, like the sartorius, as well as some other branches that might get far enough over to get to the tensor fascia lata, and so forth. So the femoral artery has one major branch that leaves it very proximally, and most commonly you're going to have several perforating branches coming off this deep femoral artery. Now, I want to note here that some people refer to the femoral artery as the superficial femoral artery, and that brings with it the assumption that it's not as large. There is, in fact, properly no superficial femoral artery, just the continuation of the femoral artery here. And the almost as large deep femoral artery is diving a bit deeper towards the medial compartment of the thigh. Now, in addition to supplying the adductor muscles in the medial compartment, and it's also going to send perforating branches that are going to go to the hamstring muscles in the posterior thigh. So they're going to pass through that intramuscular septum to get to the semimembranosus, semitendinosus, and biceps femoris muscles that are there. The deep femoral artery has a large medial circumflex femoral artery that's going to be supplying the head of the femur as well as some related structures. It has an acetabular branch that goes to the structures of the acetabulum, as well as retinacular branches that form a network around the femoral neck and will then supply blood to the femoral head. And if this vessel is compromised, it often leads to avascular necrosis of the femoral head because it's such a massive supply of blood to that area that doesn't really have any additional blood supply that's significant. We have a lateral circumflex femoral artery that leaves the deep femoral artery, although I should mention occasionally that the medial and lateral circumflex femoral arteries can come off very proximally from the femoral artery too, so that variation does happen. But the lateral circumflex femoral artery, wherever it comes from, will go off an ascending branch that's going to anastomose with the gluteal arteries, like the inferior gluteal artery, and supply some of those inferior-most gluteal muscles. It has a transverse branch that does similar things, but for the lower portion of the gluteus muscles and the anterior compartment's lateral aspect. Then we have the large descending branch of the lateral circumflex artery. It's going to be a huge blood supply to the vastus lateralis portion of the quadriceps muscles, and it goes quite a long way down in the anterior compartment of the thigh. Now, the femoral artery is going to terminate as it passes through the intramuscular septum that's kind of bridging the anterior compartment of the thigh and the medial compartment of the thigh. It's going to pass through the adductor magnus muscle, and the point at which it exits is called the adductor hiatus. And at this point, not only is the vessel on the posterior side of the knee, it's moved to the posterior side, it's also got a new name, the popliteal artery, reflecting the fact that it's in the popliteal fossa, which is the area posterior to the knee. Now, before the femoral artery travels through that adductor hiatus, it gives off a superficial branch called the descending genicular artery. So genu involves the knee, hence this branch is descending to reach the knee, and it's going to have an articular branch which heads towards the actual anterior part of the knee joint, and the patellar cluster of arteries, the patellar anastomosis, that are near the anterior side of the knee. It also has a saphenous branch that runs along with the saphenous nerve, which is a branch of the femoral nerve, and it's going to be traveling a bit more inferiorly along the medial aspect of the knee joint. It's going to meet up with the superior medial genicular artery, which is going to be coming to the same basic area from below, and there is commonly a significant amount of anastomosis occurring between these two vessels, anteriorly and a little more posteriorly. A similar thing is happening with branches of the superior lateral genicular artery and the descending branch of the lateral circumflex femoral artery. But these vessels, the superior lateral and superior medial geniculars, are both branches of the popliteal artery, and let's take a look at it. popliteal artery comes into existence as the femoral artery travels through the adductor hiatus. Now, as we've already mentioned, we've got genicular arteries in all 4 quadrants. So we have a superior lateral genicular, superior medial genicular, an inferior lateral genicular, and an inferior medial genicular artery. Now they're going to form a significant anastomosis around here, but before we get to that, let's not forget the 5th member of the genicular group. Kind of an afterthought, kind of like the 5th beetle, but basically we've got the middle genicular artery, which is going to perforate the posterior aspect of the knee joint capsule and supply structures within the joint capsule, making things like synovial fluid and supplying the internal ligaments and structures that are there. Now, returning to the other genicular arteries, they're going to form a significant network of vessels on the posterior, medial, and lateral sides of the knee that are referred to as the genicular anastomosis. And basically, this gives us a collateral route that blood can follow through to get past the popliteal artery if there's compression here, or the knee's bent for a period of time and that vessel might be compressed, and it allows just a little bit of blood to bypass the popliteal artery's main trunk here. And as we mentioned previously, we have a lot of anastomosis occurring from superior vessels. The descending branch of the lateral circumflex femoral artery meets up with the superior lateral genicular branches here and their contribution to the genicular anastomosis. And we've got the descending genicular arteries, saphenous branch, anastomosing with the superior medial genicular. Now, that is complicated enough, but it gets a little bit better in that there are branches that travel to the anterior aspect of the knee that I've shown here with kind of the cross-hatched view, and this is called the patellar anastomosis. And there are branches coming into this anastomosis from those genicular arteries, all of those genicular arteries except for the middle genicular artery, as well as contributions from the articular branch of the descending genicular artery. The popliteal artery ends as it passes through what's referred to as the tendinous arch of the soleus muscle. So it's going to be traveling into the posterior leg, passing through a gap in the soleus muscle, and at that point it's going to be traveling in the space a little bit between the superficial and deep posterior compartments of the leg. It's going to be branching into an anterior and posterior tibial artery, and the posterior tibial artery continues inferiorly in the posterior region of the leg. It's going to be supplying the plantar flexors and digital flexors in that area, and it's going to give off a large fibular artery. Now this artery is a bit more lateral, but remains in that area of the deep and superficial posterior compartments of the leg. It has some perforating branches that are going to go to the lateral compartment where the fibularis or everter muscles, sometimes called the peroneus muscles, are located. And the anterior tibial artery does an interesting thing. It passes through the interosseous membrane to go into the anterior compartment of the leg, where the dorsiflexion and digital extensor muscles are. But before it does that, it gives off the posterior tibial recurrent artery. So that's one quick thing to note, is that that anterior tibial artery is actually what gives off the posterior tibial recurrent, because it is in the posterior side before it goes through that membrane, but it's usually a branch of the anterior tibial. Not to be outdone, after it passes through the interosseous membrane, it gives off the anterior tibial recurrent artery. And both of these are going to travel superiorly, recurring, going backwards, and in the case of the posterior tibial recurrent artery, it's going to tend to join the genicular anastomosis through the inferior lateral genicular artery, whereas the anterior tibial recurrent artery, being more anterior, is going to travel towards the patellar anastomosis. And as if that weren't enough, there's a circumflex fibular branch that's going to wrap around the fibular muscle, or the head of the fibula, the bone. This can be a branch of either the posterior tibial or anterior tibial artery, and as it was much easier to illustrate coming off the anterior tibial artery, that's where I've put it right here. But this is going to wrap around the vicinity of the fibular head and join up with the genicular anastomosis on its inferior lateral side. And I want to note here that in addition to the fibular artery, there are also perforating branches to the lateral compartment of the leg coming from the anterior tibial artery as well. Now, the anterior tibial artery and posterior tibial artery and fibular arteries are all going to travel inferiorly along the leg until we reach the ankle and foot, at which point multiple other branches are going to come into existence, and that's what we'll see on the next slide. As we move from the leg into the ankle and eventually the foot, we have three somewhat large arteries that are contributing to the area. We have the posterior tibial and fibular arteries in the posterior region of the leg, and we've got the anterior tibial artery in the anterior compartment of the leg. There's a nice network across the malleoli. So on the lateral side, we've got the fibular artery giving off a posterior lateral malleolar artery, and, not surprisingly, an anterior lateral malleolar artery coming off the anterior tibial artery. These meet up and form an anastomotic network, which thankfully is named somewhat sensibly for where it's at. It's the lateral malleolar network. In the distal leg, we also have a communicating branch between the fibular and posterior tibial arteries, and then a very similar thing, as happened on the lateral side, happens on the medial side. We have anterior and posterior medial malleolar arteries coming off the anterior tibial and posterior tibial, respectively, making a medial malleolar network. So that's as we leave the distal leg and transition into the ankle and tarsus itself. But before we do that, there is going to be a small perforating branch that leaves the fibular artery and goes through the distal interosseous membrane and also contributes to the anterior lateral malleolar artery, and therefore is going to give some blood to that lateral malleolar network. As we follow the anterior tibial artery across the tarsal bones, specifically the talus, the most superior of the tarsal bones, it's going to change names to become the dorsalis pedis artery. So the artery on the dorsal aspect of the foot. It's going to have a branch that goes medially and joins up with that medial malleolar network. But since we're in the tarsal area now, this is the medial tarsal artery, and sometimes there's more than one branch, hence arteries is another option. And if there's a medial, there's also got to be a lateral tarsal artery. But it does an interesting thing. It's going across the lateral aspect of the tarsal bones and the dorsum of the foot, and it meets up again with its parent artery, the dorsalis pedis, making an arcuate artery, or a little arch across the dorsal side of the foot. We're going to have multiple dorsal metatarsal arteries extend across the dorsal side of the metatarsal bones, across the actual forefoot, and they're going to branch onto the left and right sides, or if you prefer, the medial and lateral sides of each actual toe. And these are the dorsal digital arteries. Now let's jump back and check out our buddy, the posterior tibial artery, as it crosses posterior and then inferior to the medial malleolus. It's going to branch into a medial and lateral plantar artery. These are the major blood supply to the plantar side, or the sole of the foot. We've got a nice anastomotic loop before that branch happens, and we've got a branch coming off the posterior tibial artery, and the continuation and eventual end of the fibular artery is contributing to this loop as well, and they're going to make the medial and lateral calcaneal branches of each artery. And this is going to form a calcaneal anastomosis across the posterior side of our heel, the calcaneal tuberosity on the posterior side of the foot, and that's going to be the end of the fibular and posterior tibial arteries, because then we've just got lateral and medial plantars thereafter. Now, there is a nice big anastomotic connection between the dorsalis pedis and the plantar arch of the foot. So this deep plantar artery is going to go in between the first and second metatarsals, contribute to this plantar arch, and the other major contributor to it is the lateral plantar artery. So even though this is on the medial side, it doesn't have a huge connection with the medial plantar artery, although there can be some connections there depending on the exact branching in each individual of that medial plantar artery. But off this plantar arch, we have some really interesting things happening. We've got branches that are going up in between neighboring metatarsals to actually give a little additional anastomotic blood supply with the dorsal metatarsal arteries. So these are called posterior perforating branches, and they're heading superiorly. And we have other branches stretching distally and anteriorly across the sole of the foot, plantar metatarsal arteries. Now these terms seem to be a little bit difficult, and there certainly are a lot of them, but remember that the terminology tells you a lot about where these things are, and you can kind of derive which ones have to be coming from the plantar arch, because it has to be plantar side, whereas the dorsal side is going to be coming from these more superior arcuate and dorsalis pedis sources. So the plantar metatarsal arteries are stretching forward on the underside or inferior side of the metatarsals, and as it crosses the deep transverse metatarsal ligament, it's going to magically change names to become the common plantar digital artery. So each one of these is now the same vessel, but as it's approaching the toes on the plantar side, it changes names to become the common plantar digital artery. At this point, the body decides yet again to send up some perforating branches, this time anterior perforating branches, to join and anastomose with those dorsal metatarsal arteries, and thereafter we have some other branches. But before we see those, let's revisit the medial plantar artery, which we've been ignoring this whole time. It's got a superficial branch that stretches along the medial aspect of the foot all the way to the distal medial aspect of the big toe or hallux, and it's got a deep branch that somewhere along this line is going to tend to communicate with branches of the arcuate, or pardon me, not the arcuate artery, the plantar arch, or the common plantar digital artery, or the plantar metatarsal artery that's closest to the medial side. So just keep in mind, it can branch to any of these. For sake of ease in illustration, I've put it right here with the common plantar digital artery. But remember, we've got this branch going all the way to the distal end of the big toe. We don't have anything else for the other toes. Well, those are coming from the common plantar digital arteries, and right there we have all of our plantar digital arteries proper going onto the medial and lateral plantar sides of each of the toes. All right, that is the arterial supply to the lower limb, and we'll have some of the illustrations here labeled without the animation for review, and thank you very much.